So, what are guidelines? Why are guidelines necessary in general? How are guidelines formulated? Optimal nutrition. What's complementary feeding? International guidelines for complementary feeding. And I'm not going to discuss the Egyptian guidelines, but I'm going to give it as a hint how you can formulate your own local guidelines in relation to the other international guidelines. So what are guidelines? You have an important clinical entity, great problem in your community of clinical importance, and then you have a scientific agreement from a scientific evidence about this, and then you provide the recommendations regarding the definition, the diagnosis, and the treatment. This is what are the guidelines. Then, why they are necessary? Benefit? Yes. If everyone is managing cases according to his mind, how much do you think money is lost during this procedure? How much the loss is? How much the loss of the percent of the health money? If there is no guidelines, if there is no agreement, I have done it in our hospital, and I found that 80% of the hospital resources are lost because we are not evidence-based following appointments. Okay? So, it's cost-benefit as well. Uniform decision between all physicians will be there. Medicine is prescribed the same way for all persons by different doctors. So patients and their parents will be comfortable, will be satisfied, doctors will be credible in front of these persons and these patients, so the best outcome will be achieved. How are guidelines formulated? First of all, you have the idea. For example, are we going to use antibiotics and how to use them in respiratory infections? This is a guideline. What are the guidelines of otitis media? Today we are having, what are the guidelines of feeding between 6 and 24 months age? And I remember one of my patients when she came to me and I asked her, what are you giving to him as food? And she said, are you going to discuss this with me? This is not your job. Professor Fulan, when I asked him in the first way, he told me that, ask your mother. I have no time, so ask your mother what to do, what to give, whatever. So, you should have an idea, and you should have a preparatory phase. In this preparatory phase, you select the key persons who are expert in this field, who have the know-how of this area, and they will prepare their materials regarding the guidelines needed, and they execute the guideline, they perform it. Then another group will revise these guidelines, and then it comes to publication and distribution of these guidelines. This is the way to proceed. And here we should stop by a very important point, always mentioned, level of evidence and evidence-based practice. Look at this diagram. The best available evidence comes from the literature. Should it be from your community, or can it be from an international findings? The papers you search for, is it a must to be from your local community or not? Some of the areas of importance will not differ between community and the other, so you can depend on international findings. But in other areas, there is peculiarity of your community and you may resort, or you should resort to your own evidence. Then, this is the evidence with its different levels as I'm going to show you, but you should respect the two other things while formulating the guidelines, not only the science. The clinical experience, this is number 2, and the patient values, the community values, the religious values, the social values. For example, you may recommend something that will be rejected on basis of religion. So you can never put it in a guideline. You may have a very peculiar pattern of social life, you should respect it. And here, in the clinical experience, you should respect the fact that pediatricians are busy. They are not easily giving time for their kids. So, you should have another plan and make your guidelines simplified and easy and distribute them in another way. And these are the levels, you know, of the evidence level of the different scientific literature. Actually, if you considered it in a power of A, this guideline should be followed, and it is wrong not to follow it. And if there is penalties for doctors, there should be a penalty if they disagreed, they didn't before, they didn't apply an evidence level of grading. If it is B, we recommend, we advise, it's better to follow this. C, there is no option, it's left for you. So, optimal nutrition is crucial for infant growth. It improves the morbidity and the mortality, for sure. It improves overall development. It reduces the risk for chronic illnesses, and many literature can confirm these 3 facts. So, early month exclusive breastfeeding will be the best to apply all these advantages. However, after a period, there is a phenomenon called energy gap will appear. And if you look at this diagram, you'll see the energy supplied by the breast milk in blue, and the gap will appear in brown. So, energy gap is covered till the age of 3 to 5 months by breast milk. But requirements increase and the breast milk does not increase simultaneously, similarly in an equal amount. So a gap will appear. How to cover this gap? There should be something else. What is this something else? Something replacing the breast milk, or something completing the breast milk? Completing the breast milk, because I cannot replace breast milk. So complementary feeding is meant to cover the gap. And why was it called complementary feeding? I'm going to say. WHO recommends that any complementary feeding should guarantee 4 items. Timely, when, adequate, what, safe, and properly fed. You should discuss in your guidelines when, you should discuss in your guidelines what, you should discuss in your guideline how to make it safe, and you should discuss in your guideline how to introduce or administer this food the way you give it. Then, why we shifted from the term weaning to the term complementary feeding? This was previously called weaning. Although weaning, in its language, in Arabic and English, meant to accustom, what means that we can give something in addition to breast milk, but in usual habit in our countries, the word weaning was meant to stop breastfeeding. So it was wrong terminology And by the meaning that we continue breastfeeding, giving something to complete the gap, the ideal terminology was complementary feeding of infants. Famous guidelines. It was not left for countries. WHO itself implemented their guidelines. And it's working up till now. As well, the American Academy of Pediatrics has its own guideline. The SBGN has its own. Australian has its own guidelines. They are almost similar with differences between them. So, the American Academy of Pediatrics stresses that breast milk should be continued to around the age of 6 months. American Academy acknowledges the practical challenges of prolonged breastfeeding and the need to administer adequate complementary feeding by the age of around 6 months. Australia maintained the same idea, but they stressed on the fact that cow's milk should never be given before the age of 12 months. SBGN variant. So they administered the weaning or the complementary feeding at the age of 17 weeks. That is 4 months. They accepted the start at the age of 17 weeks. And not later than 26 weeks. It shouldn't start before 17 weeks and it shouldn't be delayed beyond 26 weeks. And this is very important because this is something against the universal way of the WHO, as you know. In all countries, persons are adopting the policies of WHO that breast milk exclusively should be given up to the age of 6 months. And many literature discussed the differences between 4 and 6 month exclusive breastfeeding and. In fact, this area is very problematic, and we will see. The confusing answer of 4 or 6 or midway in between. I know. And when we met as a group of experts to discuss this area, we found that the actual practice in 70% of persons, of mothers, will feed before the age of 4. They are giving before the age of 4. And if you said 6 months, it will be 2. Because they cannot withstand till the age of 6 months. So giving this vacancy, this interval, this possible interval between 4 and 6, will give the feasibility and the practicality to the physician to manage individually cases differently. So in some persons who you know will never wait for 6 months, you can start at the age of 4 months and she can withstand. And if you said it is absolutely cut-off value of 6 months, it will be 2, 3 or something below 4 months. Now, it is not a holy book to maintain breastfeeding absolutely till the age of 6 months as exclusive way of feeding. SBGN is different. Are we going to continue breastfeeding or formula feeding during the complementary feeding stage, or it is replacement? It's fact, whether it is formula or it is breastfeeding, it should be continued with complementary feeding. What and how to start? WHO recommends small amounts, easily digested food, in a good way, decreasing according to the child grows up, and the frequency is according to this table. Between the age of 6 to 8 months, you can give 2 to 3 complementary feeds. Between the age of 9 and 11, you can give 3 to 4, and still it is working till the age of 24 months. We should start, according to the WHO, with iron-containing foods. Iron-containing foods, whether it is animal source or cereal that is supplemented with iron. Vegetables, fruits, and dairy products were allocated after these foods that contain iron. What are the foods to encourage? Starch foods, and by definition, they include cereals, roots, and starchy foods. Free of modification? No, they should be adjusted with balanced nutritional contents. So if the mother is giving the rice on her own, I will say, is this a balanced form of nutrition or not? If she's giving the wheat, boiled wheat alone, I will ask, is this a good way of nutrition or not? And these foods, if not supplemented, will deprive the child from his requirements of micronutrients, although they may give him or her the caloric needs. So the caloric gap will be covered, but the micronutrient gap will be widened. Fruits and vegetables. Take care. We need vitamin A. In addition to previously discussed iron, we need vitamin A, so choose the food that contain vitamin A. Take care of the already available, as Professor Sharif mentioned, available juices. These are not juices, these are not fruits. These are actually sugary fluids, liquid fluids, and they are nutrition empty, even if they are calorie full. Foods of animal origin, whether chicken, fish, eggs, and beef meat, are now asked to be there, and by the guidelines of the WHO, it's recommended to be given either daily or whenever possible. Okay? Poverty judges. Okay. And here is a conflict. We used to learn in our undergraduate and postgraduate teaching that eggs are allergic and try to avoid them, postpone them after the age of 1 year. Fish is allergic and postpone it after the age of 1 year. This is the traditional knowledge we know. But in fact, there is some turbulence in the current knowledge that fish can be given after the age of 6 months, eggs can be given after the age of 6 months, and if allergy developed, this will be an individual case, just to take care and they give the signs of allergy that can occur. Try it. Nothing is wrong to try it. And many of the foods that were accused to be allergic are proven to be histamine releaser rather than true allergy disease. What to avoid? The dilemma of honey. In our countries we use honey, and honey was accused for occurrence of infantile botulism. And myself, I was not aware that many cases are still reported till 2014 of infantile botulism. And I'm not interested to discuss why honey will contain this botulism. Whether because the honey will breed on a flower that contains the spores of botulinum, or whether it is from the farms that comes from cattle and this will lead, but there is still a risk. However, in our country we used to use honey without a problem. And many of the panel said, I use honey without a single case of botulism. and I return it back to the evidence-based practice guides. And where is your publication that you have given 100,000 infants honey without occurrence of single case of botulism? And I raised the question, what about those who are not thriving well, who are irritable and crying infants? And this is a classic picture maybe for infantile botulism. Are you sure this is not botulism? You are not sure. So we are not sure if it is not there or not. And we adopt the international guidelines that honey should be postponed after the age of 12 months. Some recent unpublished studies from the region may change this. Modified honey is now studied and its safety is under study. But guidelines change according to publications. When publications are available, guidelines can change. Guidelines in honey are still after the age of 12 months. Tea and coffee. We are not in the break. But it's a habit. Myself, my youngest sister was 3 years age, and she used to drink 5 cups of tea a day. And I discovered this is not strange in infants and children. And you have the habit that mothers came to you, I'm giving biscuits in tea. He is not adult, so I gave him some coffee. At the age of 7 months, they are giving tea. So tea and coffee are not accepted by definition in the guidelines. Sugary drinks mentioned by Professor Sharif are to be avoided in the complementary feeding. Even if it is natural fruit juice, it's not recommended to drink too much of these fruit juices because you are going to take something on the expense of others. He has a stomach with a specific size and specific needs. And if you are going to give him 1 liter of even naturally prepared fruit juices that is accepted, this will make deprivation of meat, of eggs, of vegetables, of others. Food processing, we have 3 items important. Recommended by the WHO. Store safely, serve it immediately after preparation. So a mother will ask you, can I prepare the vegetables with the meat and put it in the deep freeze and use it over 1 week? The recommendation is to serve it immediately after preparation. And hands of the caregivers should be clean. Caregivers and infants. Or a plastic or whatever, and aluminum. So it's an area of debate. Consistency. Texture of complementary food should be suitable to infant stage. Starting with puree, to lumpy, then normal texture. And try to avoid the blender. And while I'm taking studies on food preparation, I knew that a glass blender. Yes, time is okay. I have 2 minutes. أنا عامل لنفسي تايمر بس. أنا فاضل لي 3 دقايق بالظبط. جبار. Okay. Avoid blender use because of many side effects of this blender. We are not going to pass by it. Allergy. Allergy is there, but the most recent literature in this area is that delay the solid foods beyond the age of 1 year did not change the risk of occurrence of allergy at all. Those started at the age of 6 months were similar to those who started at the age of 12 months. There is no risk decreasing by avoidance of food, except some studies on cow's milk that demonstrated if there is a positive family history for cow's milk allergy, the risk is there, and you may postpone it for this sector of persons, not as a general rule for the community. Duration of breastfeeding recommended to till 24 months by the WHO, and modified animal food is never used before the age of 12 months. So we have some Egyptian differences I'm not going to stand with, but if you look at this, this is guideline formulation. If you look at this, some of the persons started weaning before the age of 2 months. If this is the breastfeeding with complementary feeding, it started very early. Dr. Sharif and Dr. Sharifa gave some of the problems in our community, so I'm not going to stand with them. This is a group of experts who met to formulate guidelines for Egypt. It can be formulated for any area in the Middle East. And we grouped the foods to encourage and the foods to avoid. And we suggested a sequence of foods to be administered in the complementary feeding schedule. And we can come to the sum up. Because some problems are unique to your area, like Egypt or any country, you can formulate your own guidelines based on the international guidelines with some differences that respect the social, the cultural, the ethnic, the religious differences. Some points were stressed upon. Guidelines are now available and ready for publication.